Hi there, I'm Serene Brooks with Goal Nutrition and Diabetes Specialty. Today I want to talk to you about something called hypoglycemia unawareness. So hypoglycemia for someone with type 1 diabetes means their blood sugar is low, so below 70. And when this happens, there are hormones that are released like adrenaline and cortisol, and it causes you to have symptoms. So if you have type 1 diabetes, you'll know what I'm talking about, right? You get shaky, maybe confused, sweaty, um, you don't feel right, you feel weak. There's this cascade of events that are happening with hormones to signal to your body that your blood sugars are low and you need to do something about it right away. And it is dangerous to have low blood sugars. Because of these symptoms, you do get confused. And we need to remember that glucose is the fuel for our brain. And so when we don't have enough of it, we can't think clearly for ourselves. So for someone with type 1, it is dangerous for them to be low. One point I want to bring out here is make sure if you are living with type 1 diabetes that those around you know how to help you when you are low. Because if you get too low, you may not be able to help yourself, even though in normal circumstances you would know exactly what to do, because that glucose is the fuel for your brain. So when blood sugars go low and we get these symptoms, we're able to quickly treat them. Now, when someone has hypoglycemia unawareness, it means that they are at a point where they don't have these symptoms when they go low. So they don't feel low, they don't feel different. It's especially dangerous at night when you're sleeping. It doesn't wake you up because you don't feel shaky or sweaty or confused or tired or hungry. All these feelings you get when you have hypoglycemia, those feelings are gone. It typically happens when a person's blood sugars are running a little bit low frequently, or they have frequent lows. Maybe they run a little bit lower than normal all the time, and over time their body gets accustomed to how it feels when you're low, and soon they don't have the awareness of those lows anymore. So it's a situation that needs to be addressed. One thing would be is if you have a continuous glucose monitor, to be sure the alerts are set to alert you when you're low. If you don't have a continuous glucose monitor, it would be possibly a good time to get one and invest in one and have alerts set until you can shift that awareness back. So you can gain back the awareness of low blood sugars. Typically, people can gradually bring their blood sugar levels up over time so that they're not in that low range all the time, and their body starts to feel accustomed to blood sugars that are above 70, and their body starts to learn to adjust. And then when blood sugars go low, they start feeling them again. It can take a little time. It's a little bit of a process, but if you are having hypoglycemia unawareness, please seek medical help. Go to your primary care provider, go to your endocrinologist, and maybe you could even have some follow-up with a certified diabetes care and education specialist to help you come back to where you can feel those low blood sugars when they come on. It's very dangerous to not be able to feel them, because often by the time you realize they're low, you're really, really low and could potentially be too low to be able to help yourself.